wildfire. So my story is also on wildfire. So here we go. Um, I want to tell you about the first time I had a panic attack. It was 2018. I walked into our NICU to start my day and was hit with the smell of wildfire smoke. Our wildfire season and the thick, black blankets of smoke outside were overwhelming our filtration systems. I walked around to each family that day to do what we do as physicians and nurses: calm, reassure, problem solve. We got a few additional air filtration units in. It was far from perfect. Those tiny lungs, the size of avocado pits, were breathing in pollution we estimate to be 10 times as toxic as the regular air pollution we breathe. I'm sorry, I just lost my place in my story. My apologies.
Take your time.
But I felt like I could take a bad situation and make it better. For the moment, that was enough. That wasn't the day I had my panic attack. It was a couple of years later, sending my daughter off to school. This was year 2 of the pandemic. I had spent months working with her district on reopening safely, better ventilation, better filtration, drawing on my background in environmental science. But progress on infrastructure is slow. Almost a year later, I found myself facing a difficult reality. She'd done most of kindergarten on Zoom and was heading off to her first day of first grade. We packed her lunch, got her backpack ready. It was as I grabbed her favorite pink mask that my heart started beating so fast it felt like it would rip out of my chest. I sat down on the steps, tried to focus on my breath, fixed a smile on my face as she ran towards the door. The air quality index that day was going to be 150 plus. Like my patients, the small babies, my baby was going into a smoke-choked classroom. I couldn't problem solve this one. I couldn't keep her safe. I took that failure personally because I'd been working so hard on climate-ready schools, and I believed that the harder I pushed, the more ground we'd gain, that progress was a straight line from effort to outcome. That belief came from my father, who told me his story in bits and pieces over the years, like a mosaic slowly coming together. Growing up in a famine-stricken Indian village, the son of poor farmers, a troublemaker expelled from school after his classmates pulled a prank and blamed him. His own father wept so violently that night, it shook something loose in him. From there, through sheer determination, he became a successful doctor, capable of supporting his 5 siblings and their families. That was the story I carried into my own life, that hard work with its own guarantee. But that day, holding that mask, I realized it wasn't enough. My hard work wasn't enough. I wasn't enough. Once anxiety like that has been unleashed, it's hard to put it back in the bottle. But it made one thing clear. This problem was bigger than my individual effort. My anxiety came from feeling alone with a problem too big for me alone. I learned with time that my father's mosaic had more pieces to it than I'd understood. His success was also thanks to his mother's and uncle's sacrifices. His uncles never married, never had children of their own, so that all their income could go towards lifting the rest of the family out of poverty by investing in my father. He succeeded because of a community. Now I needed to find mine. Some of my work on wildfires caught the attention of a donor. I remember the call. She'd ask if I'd build a blueprint for what a climate resilient school could look like. I said, sure, why not understanding what I'd signed up for, nor that I couldn't do it alone. I started reaching out to every expert I could find: engineers, economists, health professionals, psychologists, teachers, bracing for no. Instead, one by one, they said yes. That's something I've learned about work for kids. People show up for it in a way they don't always show up for other things. Still, it wasn't easy bringing that many perspectives into one report. 6 months in, I sat in agony, sure that I couldn't get it over the finish line. That's when 2 members of the group stepped up and found a way forward with me. 6 years later, that coalition has grown to include parents and students. It's working to direct statewide bonds toward climate resilience, and it's close to passing legislation for a seal of climate literacy to strengthen California's climate-ready graduates. I've come to accept that I can't keep my baby safe on my own. It takes identifying the problem, understanding the root cause, finding your people, but the village doesn't build itself. I found mine because I picked up the phone and kept reaching out even when I didn't know what I was doing. Every one of you in this room is someone's village, whether you know it yet or not. Somewhere tonight, there's a parent on their own set of steps, holding their own version of that mask, feeling like it's all on them. Our wildfire seasons are getting longer. Our classrooms aren't getting safer fast enough. That's the urgency. And you have a story like mine, a moment that shook you into action or one still waiting to. This fall, we're teaching a narrative class to help you tell it because the movement we need isn't built on data alone. It's built on stories like yours waiting to be told.
Oh my God, Lisa. If anybody wants to come off mute and sing the praises, I mean, wow, right? Like this is such powerful art. Thank you, Lisa. I'm so grateful for you
Well, I
sharing.
should say Ashley's also underselling herself. It is the thing, thanks to the work and the teaching of Ashley McClure, that folks like Amanda and I can tell the stories that we do.
Oh, if only. Okay, I'm gonna screen share so you can share a little bit more about a way that people can get some support if you want to work on your story, which, like Lisa said, we believe should be in the world. So here's.
So Ashley, myself, Nilu Tumala, who is an ENT surgeon at NYU Langone, and Paige Stojic, who leads People Power Health. Together, we are teaching this course in the fall. Through this course, you will learn how to develop narrative leadership skills, translate your frontline health experiences into these types of compelling narratives. What we're really hoping is that it strengthens your role as a health professional to be trusted messengers. I know that all of us are seeing the data right now on trust in the medical profession. Trust has eroded throughout all professions, but we are still at the top there. So let's hold on to the superpower that we still have and applying narrative practices to advance collective action and policy. As I think you've heard many times in this call, we are feeling creatures first and thinking creatures maybe third or fourth. And so it's so important if we want to change the trajectory, if we want to improve health outcomes, to access people's heart first. This is a CME course, and so you will collect CME for doing so. And you can go to the next slide, please. As I mentioned, the four of us are the instructors. And so this course really started with Ashley and Paige, and Nilu and I have both done this training over time, and we are course directors alongside Paige and Ashley as well. We meet in person during these dates, and then in between, you are working on your narratives and you're getting coaching from us on really refining it. As Ashley mentioned, I think you probably heard the level of detail that Amanda and I were providing in that story. It doesn't come easily. It takes a lot of digging into who you are. We're really remembering what those moments were to provide that level of detail, but also to dig in on. I remember it took several rounds of coaching for me, that piece of the story that I told about my father. I kept getting questions from the coach. Well, why? Why do you think working hard is so important? And that was the revelation that came to me from really digging deep about who I was and my identity to coming up with that piece of the story. But that's why telling a good story takes that kind of work, takes that kind of coaching, and takes that kind of space to reach those kinds of things that are really personal to you, but as Ashley said, the personal to the universal. Next slide, please.
That's it. So we
it. Okay, that's
yeah.
All right.
Spacious. Yes,
okay,
we have time.
Ashley.
If we have time, if anybody has questions about it, or feedback in general, we have time to discuss a little. Yeah, time management was spot on. Does anybody think it might be of interest for you this fall?
Definitely.
We could probably stop. Yeah, Dr.
I'm signing
Hart?
up. Yes.